Hello, I'm Dr. Michael Kloess, one of the providers here at Our Lady of Hope Clinic. Myself and Dr. Ann Vogt-Johnson, who helped start this clinic, we ended up talking about what an ideal practice would look like. And we enjoyed the idea of practicing medicine that allowed us to care for the uninsured while at the same time caring for those benefactor patients or patients who support the clinic, and allow those two groups of people to come and share the same waiting room. In 2008, when a group of people here in Madison started talking about creating a clinic, we talked about what it really was that we wanted to accomplish. And the mission at that point we set out was to serve those in need. What we felt was not only the primary care needs of many people who are uninsured that weren't being met, but also the need for a pro-life clinic. There's lots of good providers in town, but there's not a clinic that's dedicated to Catholic pro-life healthcare. So we thought of a clinic model that would allow us to do that. We allow our benefactor patients who contribute annually to the clinic to support our mission to serve the uninsured. 45% or less of our patient visits are to benefactor patients, and then 55%, according to our bylaws, goes to uninsured patients who otherwise wouldn't have access to primary care.
My name is Ramon Torres, and I've been a patient right here for a couple of years already. I'm from Puerto Rico, and I searched online because I needed a doctor. It was really good to come here because I didn't have a job. I didn't have the money to go to another doctor or to the emergency room, and that's why it was good to come here, because right here you don't have to pay nothing. If you're in need and you need to see a doctor right away, and you can't afford another doctor or an emergency room, come here because it's very helpful.
My name is Curtis D. Welton. I'm president and treasurer of Welton Enterprises, Inc., which is a commercial real estate management and development company in the Madison, Wisconsin area. My journey of discovery with Our Lady of Hope Clinic started a long time ago. They explained what they were going to be doing and what they were looking for in terms of benefactors, and I thought it sounded great. So my wife and I decided that we would be benefactors, and then my wife volunteered her time translating for the people who couldn't speak English. Pretty much most of my charity dollars go to Catholic organizations, but I think they really make the biggest difference because they take 100% of your money and they use it for what it is they say they're going to use it for. The healthcare industry and the insurance industry have pretty much forced everybody to support things like birth control and abortion. And this is a clinic that will not participate in the degradation of our culture with what it does for its patients.
We came up with this idea to create a pro-life Catholic clinic, really three-pronged mission statement, to care for those who are uninsured, to care for our benefactor patients who provide the funds for the clinic, and also to care for those who are on NFP clients, natural family planning. And those three are what our mission is to the clinic.
My name is Steve, this is Laura. We are the Carlin family, and we're going to talk about how Our Lady of Hope Clinic helped us welcome a new baby into the world. Laura has a health condition that has led us to struggle with infertility and multiple miscarriages. It's a problem where Laura had been with mainstream doctors for probably about 8 or 9 years, and none of them could provide her, even the specialists could not provide her with a definitive diagnosis. We found Our Lady of Hope Clinic, and by the end of the first visit, Dr. Kloess thought he knew what the problem was, and by the end of the second and some lab work, he knew what it was, and so he's since helped us. And we, by the grace of God, found ourselves expecting another baby after 2 miscarriages. And we knew that it wouldn't have been possible without Dr. Kloess and Our Lady of Hope Clinic.
Having John Paul born in my arms, I had this amazing feeling of joy and peace. You know, at every opportunity I have, I always recommend Creighton Model and Our Lady of Hope Clinic. I certainly encourage other women to begin charting according to the Creighton Model or according to natural family planning model so that these problems can be diagnosed immediately. If you are somebody who has noticed irregular cycle or has noticed something that would suggest a gynecological issue, I would not hesitate to contact Our Lady of Hope Clinic and to start working with Dr. Mike. There's a real pursuit for truth. I mean, that's what our faith is, but that's also, I think, what science should be, is a pursuit for the truth behind the problems and trying to actually solve them and doing no harm in the process.
As an NFP consultant, I have been trained in NAPRO technology, and natural procreative technology, or NAPRO technology, which has been researched for the past 30 years. We practice standard medicine, we practice good, high-quality primary care, but we do it outside of the insurance system.
On a personal level, we are so grateful that it's so close and convenient that we can call our doctor at every opportunity. The fact that we are not just numbers in a system for him, but that we are not only patients, but over these years, friends. Dr. Kloess sits down, he knows who you are already, so he doesn't have to look up your name as you come into the room and mispronounce your name in our case. You know, he knows us already and can pick up where we left off from the last visit. He enjoys being a doctor, he enjoys examining his patients. Our Lady of Hope Clinic was a no-brainer for our family. Our hearts are in the pro-life movement, and to have a doctor who is committed to living that out in his practice, I think it's not only positive, but it's courageous.
Dr. Kloess is so good and friendly and always smiling, and he always tried to help you the way it is and beyond. Dr. Kloess is a good person. We need more people like him in the community that are willing to help like he does right here for this community.